I'm a registered dietitian.
I'm an exercise physiologist.
I'm a cardiologist.
I'm a clinical pharmacy coordinator.
I'm living with heart disease every day.
And I live with coronary artery disease.
Some studies have shown that somewhere between 70 and 90% of all doctor visits are stress-related. And so we know that there is a huge connection between emotional health and physical health. Stress-related illness can cost upwards of $300 billion a year in absences from work, those doctor visits, medications to help treat the illnesses or treat anxiety, and then stress management things like seeing a therapist perhaps, or massage therapy, all of those things that people do to help reduce that level of stress in their lives. Stress can affect our bodies in many different ways. What happens when we are stressed is that all of the blood pumps away from our internal organs and into our limbs to prepare us for that fight or flight. So when your organs in the middle of your body aren't getting the blood and the oxygen they need, that can have a really detrimental effect on your health. We also know that stress increases your blood pressure, which can have a negative effect on heart health. It can also affect your sleep, give you migraines. You know, it can do all kinds of things that really negatively impact your health. There's a fairly new field called Psychoneuroimmunology that studies how what's going on in our brains and our mind and our emotional health, how that affects our bodies on a cellular level and affects our immunity. In 2004 and 2006, they did a study on exposing people to the cold virus and the flu virus, and people who reported having more positive emotional states were less likely to contract those diseases. Although there is conflicting literature about whether stress directly causes certain diseases, we do know that it affects the body in a negative way that can then lead to more serious diseases. So we know that stress increases the blood pressure, and with long-term increased blood pressure, you're at higher risk for heart disease, stroke, all of those kinds of things. So while there might not be a direct link, there is perhaps an indirect link. I think it's important for women to remember to take care of themselves. Women typically get into the taking care of everybody else, and they get put at the very bottom. And just, a few minutes a day, doing some breathing exercises, doing a couple of relaxation things, or maybe some yoga, can really help bring that stress level down and, counteract the effects that stress has on the body. The first technique that you can use to help reduce stress is called the Relaxation Response. This was discovered by Herb Benson, who was a physician at Harvard, and he did a lot of research on people who did transcendental meditation. And he found that they had low blood pressure to begin with, and then when they meditated, it went even lower. And so this technique came out of all of that research, and it takes only a few minutes, and it can really bring down that stress level. To do this technique, all you need is a quiet place and a couple of minutes. So if you would, just get comfortable in your chair. Start by taking a couple of deep breaths. You could close your eyes if you'd like. If not, just find a spot to focus on and then relax your eyes. And I'd like you to think of a word that makes you feel calm and relaxed. It could be a word like peace, love, ocean, God, anything that makes you feel relaxed. And we'll come back to this word in just a minute. But I'd like you to bring your attention back to your body, taking some comfortable breaths, feeling your belly expand as you inhale and contract as you exhale. I'd like you to start with the top of your head and forehead. And go ahead and relax and release those muscles. And then bring your attention into your jaw and cheeks, allowing those muscles to loosen and relax. And then down into your neck and shoulders, allowing those shoulders to drop down. And bringing that relaxation down through your arms, through your elbows, wrists, and hands. And then relaxing your chest and upper back. And then your abdomen and lower back. Relaxing your hips and pelvis. And down into your upper legs. Relaxing your knees and lower legs. Into your ankles and feet. And then all the way to the tips of your toes. So now that your body's relaxed, I'd like you to bring your attention back to your breath and back to that calming word. And I'd like you to say that word silently to yourself on each exhale. And if your mind wanders, which it probably will, just gently bring your attention back to the breath and back to that word. And I'm just going to let you do this for a couple of minutes on your own. And so whenever you're ready, I'd like you to come back to your chair and back to the room, perhaps wiggling your fingers and toes a little bit. And whenever you're ready, you can open your eyes, feeling refreshed, relaxed, and alert. I'm Molly Ellefson, and I'm a mind-body coach.